Hi, very good morning. So I hope we are streaming fine. Let me know if you have any issues, okay? So how many of you woke up at 5 o'clock today? Okay, Regina, are you still seeing Apple or can you, is it streaming live for you? Hi Saida. Hi Anu. Sajid. Hello. Hi Saira. Okay Anu. Yeah. Good morning. Good morning Ramesh. Saida, you woke up at 4:30. Okay, good. Right, so before going into today's discussion, right, so we'll be having this text-based MCQ discussion today. Before that, we'll start with clarification of doubts, which most of you posed, right? We have a few terminologies and all, and we'll try to cover them first, and then we'll proceed with today's discussion. Hi Aishwarya, a very good morning. Yeah, so as you asked, like the difference between mandibular notch, glenoid fossa, mandibular fossa, sigmoid notch, carotid notch, right? So what we had discussed yesterday is 99% true, so, right? We had some discussion, so we'll just confirm that once again, right? And Prithvi, I couldn't get any particular shapes of alveoli. I tried, but I couldn't get any any literature supporting specific shapes of alveoli for different teeth. So as you know, as you can see here, just one second. Yeah. The depression which we discussed yesterday between the condylar and carotid process is nothing but mandibular notch, and this is also called as sigmoid notch, right? So this is mandibular notch or sigmoid notch, right? Yeah, so that's clear, okay? And we have this glenoid fossa. Glenoid fossa is that component of, it's a part of temporal bone where the condyle articulates. Even that was fine yesterday, right? And we have another term called as mandibular fossa. Glenoid fossa, also synonymously called as or mentioned as mandibular fossa. It's a part of temporal bone which articulates with mandibular condyle, right? So mandibular notch and sigmoid notch are found on mandible, depression between the condyle and carotid process, whereas glenoid fossa or mandibular fossa, the part of temporal bone which articulate with the mandibular condyle. And then regarding carotid notch, so one of you asked, and I think I mentioned the same. So this depression which you can feel, during giving the block also, I and B block, we just palpate with our thumb, right? The anterior extension or the border of your ramus. So this is a carotid notch. The depression here, yeah, this is a carotid notch. So you have a temporal crest here, and this will be your notch, carotid notch. And lingual foramen, I saw one of you asking regarding lingual foramen, which we haven't discussed yesterday. So lingual foramen is found on the lingual aspect on the symphysis, that is in the body of mandible, in the symphysis region on the inner aspect where you find this genial tubercles or mental spine. In those areas you can have a midline structure, a lingual foramen, midline foramen, which is nothing but lingual foramen, which was not visible yesterday also, right? So lingual foramen is situated on lingual side of anterior mandible through which small blood vessels pass. It's not a major foramen, it's a minor, and it's situated in midline of internal surface of mandible at level or superior to that of mental spines, right? So we have, as Abhishek rightly pointed out yesterday, we have two spines, two superior and two inferior, total 4 tubercles or spines. So it's present almost at their level. Okay, it's even visible through radiograph. I mean, in case of anterior IOPS, you can just check out Google. You have few IOPS where you have this lingual foramen, right? Or if you want, I can just show you now itself. So can you look at this dot here, a black color, a radiolucency? So that's your lingual foramen. Okay. Yeah. So I hope it's clear with the terminologies, right? Mandibular fossa, mandibular notch, glenoid fossa, right? Sigmoid notch, and also about lingual foramen, right? In that case, also we discussed about carotid notch. Okay. Yeah. We'll just proceed with today's MCQs. Yeah, we'll start with the first one. I hope it's streaming fine. Okay. Yeah, we have our first question. Which of the following lymph node groups extend from the base of the skull to the root of the neck? Options: facial nodes, occipital nodes, deep cervical nodes, and jugulodigastric nodes. So which among the following group of lymph nodes extend from the base of the skull to the tooth of neck? I mean to the root of neck. I'm sorry, it's not tooth, it's root. Yes, Regina. Yes, Aishwarya. Ramesh. Yeah, facial nodes, occipital, deep cervical, and jugulodigastric. Yeah, it's not tooth, it's root. R-O-O-T, root. To the root of neck. Base of the skull to the root of neck. So we have deep cervical nodes which are situated along the length of internal jugular vein. Okay, it's sent to pharynx and esophagus, extending from the base of the skull to the root of the neck. So deep cervical lymph nodes are located along the length of internal jugular vein on each side, and they're present deep in relation to sternocleidomastoid muscle. and these extend from the base of the skull to root of neck, adjacent to pharynx, esophagus, and trachea. The deep cervical nodes are classified based on the relationship with sternocleidomastoid as either superior or inferior, and these drain most of these structures. I mean, these have efferents from salivary and thyroid glands, tongue, tonsil, nose, pharynx, and larynx. So all these structures, the lymph from these structures drains into these deep cervical lymph nodes. So deep cervical lymph nodes are responsible for drainage of most of the circular chain of nodes and receive direct efferents from salivary and thyroid glands, tongue, tonsil, nose, pharynx, as well as larynx. So yesterday also we discussed about lymphatic drainage. If you remember, in case of posterior triangle, no, what was the topic we discussed? Posterior triangle, muscles, and while discussing one topic, I said like anterior part drains into submandibular nodes. Lateral wall of nose, I guess. Yes, lateral wall of nose while discussing. Yeah, the anterior part, you said, it drains into these submandibular nodes. Even these regional lymph nodes, like we have these parotid nodes, we have these submandibular nodes, all these further drain into deep cervical lymph nodes, right? So submandibular nodes, parotid nodes, submental lymph nodes, all these ultimately drain into deep cervical lymph nodes. So deep cervical lymph nodes are those which extend from the base of the skull to the root of the neck. Along they travel, I mean they are located along the length of internal jugular vein, right? And they are present deep in relation to sternocleidomastoid muscle, and they receive efferents from larynx, thyroid, tongue, and all these regional lymph nodes. Okay. So option C, deep cervical nodes, is the appropriate answer. Yeah, we'll just move on with the next question. I have seen your discussion regarding this 5 a.m. Motivation, something like that, right? I have seen some discussion at room. So what's it like? How are you planning? Like, are you planning to have some kind of discussion at 5 a.m. or are you planning to have a separate group? I think at 5 a.m. You start singing, record your voice, sing a song, record it, and leave it in a group. Of course you can, You have the choice, right? You can start one group, that's not an issue. You can even title it as 5 a.m. club. And you can even add me if you want. Right, we'll have our second question. Yeah, we'll have a discussion regarding that later, okay? Right. Second one, in which of the following locations would one most likely find yellow bone marrow? Head of long bones, center of long bones, ribs, and cranial bones. So where do you find, or most likely regions to find yellow bone marrow? Okay. Yes, Aishwarya. Lokanath. Lokanath, I hope you have joined our update group. Yes, Prithvi, Rakina, Ramesh. Sairam, this is live, right? I hope it is streaming fine. Live is not available today. I didn't get you. Okay, Lokanath. Yeah. So where do you find this yellow marrow? So first of all, yellow bone marrow is something which is concerned with storage of fat, nothing to do with erythropoiesis or hemopoiesis, to be more specific. So red bone marrow is associated or concerned with hemopoiesis. So yellow bone marrow is found mostly in case of the center of the long bones. And also, as I said, yellow bone marrow primary function is fat storage, and it's found in center of long bones. And as you know, the bones are not solid, they have cavities within which is filled with marrow, right? So red bone marrow is concerned with hemopoiesis. Erythropoiesis is a term which is used in specific for production of erythrocytes. And when the child is approximately 6 to 7 years of age, yellow bone marrow begins to appear. So the time of appearance of yellow bone marrow. When the child is 7 years of age, yellow bone marrow begins to appear in the distal bones of limbs. And this replacement of marrow gradually moves proximally, so that by the time the person becomes an adult, red bone marrow is restricted only to bones of skull, vertebral column, thoracic cage, girdle bones, and head of humerus and femur. So in case of adults, the locations where you find red bone marrow include bones of skull, cranium, vertebral column, thoracic cage, girdle bones, head of humerus and femur. Just make a note of this point, right? Yeah. In rest of the areas, you find yellow bone marrow. So in which of the following locations would one most likely find yellow bone marrow? Option B, center of long bones, is more appropriate, right? Yes, Saida? Okay, I hope you got the answer. Right, we'll move on to the next question then. Yeah, you have your third question here. Shaking your head while saying no or yes is facilitated by which joints? When you're shaking your head while saying no or yes, no, yes. So it's facilitated by which joints? option 1, intervertebral and atlantoaxial joints respectively, atlantoaxial and costovertebral joints respectively, atlantoaxial and atlanto-occipital joints respectively. Option D, none. Bareness, we have 100 years. I was wondering where you have been. Yes, Ramesh. Yes, Bareness. Prithvi, Aishwarya, Saida, Lokanath. So shaking your head while saying no. When you say no, you move your head along this plane, right? No. When you say yes, so permitted by which joints? Okay. You shouldn't sleep once you wake up at 5, whether, no matter or irrespective of live sessions. Okay. So atlantoaxial joint, it's a synovial articulation, right? So it's a joint between the inferior articulating facets of the atlas, the first cervical vertebrae, and the superior articulating facets of axis. So between atlas and axis, atlantoaxial joint. So this permits the head movement as in when you're saying no, right? So this is permitted by your atlantoaxial joint. Whereas you have something called as atlanto-occipital joint, where it permits rocking or nodding movements of head as in saying yes. So this is again a synovial articulation between the superior articulating facets of atlas, that is the first cervical vertebrae, and occipital condyles of skull. So atlantoaxial permits a no kind of movements, whereas atlantoaxis permits this horizontal no movement, whereas atlantoaxial nodding movements of your head, right? So it's streaming. Okay, fine. Yeah. So option C is the appropriate answer. Good. So we'll move on to the fourth one. Abhishek seems to be offline. Also Nidhi. Right. The fourth one, a dentist while placing a crown accidentally drops it into patient's mouth. As a result, patient aspirates, not ingestion but aspiration, entering into the respiratory tract. So patient aspirates the crown. Chest X-ray is taken, which will reveal that the crown is lodged mostly in. Yes, Bernice? So we have already had this discussion yesterday, right? So let me just give you the options also. Okay, good. So we have options: trachea, right primary bronchus, left primary bronchus, pulmonary artery. So, dentist, while placing a crown, accidentally drops the crown in the patient's oral cavity. So patient aspirates. So, like, in which location do you find it? Most probably after a chest X-ray is taken. So I think you know the obvious reason also, right? So right trachea, right bronchus. Right bronchus is comparatively short and more vertical in its orientation. So there is a greater chance for the foreign object to enter directly into the right bronchus. Yeah, when foreign objects are aspirated into trachea, they usually pass into the right primary bronchus because it is larger, straighter, and shorter than the left. It's also in a more direct line with trachea. So right bronchus is the right answer. It seems like you're finding the questions easy, so we'll try to have more tougher ones. Okay, Anu. Okay, let me just give you the options, then you can try answering them. Come on, options are not still complete. Yeah, so 1, 2, 3, 4, 5, 6, 7. We have 7 options. So the question is, which or the external carotid artery, ECA, external carotid artery within the parotid gland just behind the neck of mandible, where external carotid artery gives off 2 final branches. So what are the final branches of external carotid? If you remember, we have 8 branches of external carotid artery. So what are the 2 final terminating branches of ECA? We have option superficial temporal, superior thyroid, posterior auricular, occipital, maxillary, facial, and suprascapular. Okay. Yes, Bernice, since you are answering even before giving the options, I have to add up more number of options. So Ramesh, you say A and E, that is superficial temporal and maxillary. Okay. Anu, you also stick on to the same, superficial temporal and maxillary. Superior thyroid. Okay. Superior thyroid, as far as I remember, it is the anterior branch, right? But not the terminal branch. So either you say A and C, superficial temporal and posterior auricular artery. Yes, Aishwarya, A and E. So first of all, the branches of external carotid artery, I mean, we have most of them with options except for suprascapular. So we have superior thyroid, lingual artery, facial artery, ascending pharyngeal, occipital, posterior auricular, maxillary artery and superficial temporal artery. 8 branches, right? So we have 8 branches. Just look at the picture, Bernice, it's given in text. Also, we'll have one video on this. So ECA, it's very important, right? So we have 8 branches from the external carotid artery. Superior thyroid, lingual artery, facial artery, ascending pharyngeal, occipital, posterior auricular, maxillary, and then you have superficial temporal artery. So superficial temporal artery and maxillary artery are the final terminating or terminal branches of external carotid artery. So this ECA supplies the structures within the neck, face, scalp, and also supplies maxilla and tongue. So it terminates within the parotid gland and just behind the neck of mandible, where it gives off 2 final branches, superficial temporal and maxillary, right? So option A and option E, superficial temporal and posterior, axillary artery are the appropriate answers, A and E. Yes, Regina. Yes, Prithvi. Okay. Right. So we'll move on to the 6th one. A rather comparatively a simple question. Let's see how many of you are going to answer this right. And I'll not give you the options, right? So try without options, we'll see. Sixth, which organelle is known as cell's power plant and is also maternally transmitted? Oh, okay, Ramesh, you gave us the mnemonic, right? Thanks. Some anatomists like freaking out poor medical students. Thanks, Ramesh. I hope it will be useful for all of you. Hi, Vinoda. Yes, Sairam. Yes, Lokanath. Yeah, which organelle is known as cell's power plant and is also maternally transmitted? So energy currency of the cell, energy currency of the cell is ATP, right? Powerhouse of the cell, it's mitochondria. Okay. So lysosomes, they constitute the lysis, the digestive system of the cell. Peroxisomes, they contain enzymes that help in detoxifying various harmful substances, peroxisomes. So mitochondria, powerhouse of cell, associated with generation of ATP. So they are mainly involved in catabolism, right? Yeah, good. So we have an unanimous answer, mitochondria. We'll have our 7th one then. Yeah, related to muscles now. all of the muscles of quadriceps, the thigh muscles, quadriceps, serve to extend or straighten the knee. However, one of them also flexes the thigh onto the pelvis. So all the muscles of quadriceps group serve to extend or straighten the knee. Which one also flexes the thigh onto the pelvis? So we have options: rectus femoris, vastus lateralis, vastus intermedius, and vastus medius. Yeah, the first one is not femurs, it is femoris, Femoris. I'm sorry. So you don't have smileys in options, right? Why are you giving me smileys then? Femoris. First option is rectus femoris. Okay. Okay, we know that. Right. So thigh muscle, it's a quadriceps major. It's a major muscle, forms a major mass of your thigh, the anterior aspect and the lateral aspect. So quadriceps femoris, it forms a major muscle mass in front and outside of thigh, covering most of the front and sides of femur bone, the longest bone in the body. And this quadriceps femoris, quadra, 4, so it has 4 components. All are innervated by femoral nerve. The components of quadriceps femoris has 4 parts, which include rectus femoris, vastus lateralis, intermedius, and medialis, right? You've seen them in the options. So vastus lateralis, intermedius, and medialis, all these serve to extend the thigh. All extend or straighten the knee, right? However, we have rectus femoris, which extends or straightens the knee and also flexes the thigh onto the pelvis. And also we have this hamstring group of muscles. If you remember hamstring injuries, they say, so hamstring muscles, they lie in the posterior compartment, right? So as I said, this quadriceps major lies or forms the bulk of anterior aspect or anterior compartment, posterior compartment being formed by hamstring group of muscles, which includes biceps femoris, semitendinosus, and semimembranosus. So hamstring muscles forming the posterior compartment include biceps femoris, semitendinosus, and semimembranosus. So it's better if you can really look at the pictures and simultaneously discuss this. So I'll not go deeper into these aspects, right? I'm just naming them, and just make a note of them. And as I said, among quadriceps femoris, rectus femoris extends or straightens the knee and also flexes the thigh onto the pelvis, right? So option A, as most of you guessed, it's the right answer. Yeah, we have one question also, right? Composite muscles. Yes. So we'll have our next question then in that case. So we still have 3 more questions to go. I think we can complete off by 7 at least. So how many of you have college? I mean, how many of you are going to college at 9 o'clock or 8:45? Gaishwari 8:30. So 8:30 Vinoda Saida. Okay, Lokanath also. Sairam at 9, Anu at 9. What time do you usually get up? Anu and Sairam, Lokanath, do you get up at 8:55 every day? And Aishwarya, Saida and Vinoda, I guess you get up at 8:25. Okay, it's not even 5 to 9, Anu. You wake up at 9 o'clock. Sairam 5 o'clock, good. Okay. So I assumed that you would wake up at least 5 minutes early, but to my surprise, you're all on time. You're all on time, not to the college, but out of bed. So we'll have one question from the central nervous system, the anatomy. Okay, Saram, your name is Harish. Okay, Harish. Hi. Yeah, we'll have our 8th question then. Okay, so Anu, you go on call. 8th, the hypothalamus is a part of basal nuclei, diencephalon, cerebrum and cerebellum. So basal nuclei, diencephalon, cerebrum and cerebellum. Hypothalamus is a part of. So brain, as you know, it lies in the cranial cavity made up of billions of nerve cells and supporting cells which are called as glia. It contains grey matter and white matter. So it can be divided into 4 main parts: cerebrum, diencephalon, brainstem and cerebellum. So cerebrum, cerebellum, brainstem and diencephalon. Cerebrum is the largest part of brain, consisting of 5 paired lobes, which we discussed yesterday with respect to some of the functions, right? Motor functions. We had different areas in different lobes of the cerebrum, and we have 2 cerebral hemispheres which are joined by a mass of white matter called corpus callosum, which we are all familiar with. So cerebrum accounts for 80% of brain's mass and is concerned with higher functions, including perception of sensory impulses, voluntary movement, memory, thought, reasoning, as we have seen different areas yesterday. So we have this parietal temporal lobe, right? Occipital lobe. Yeah. And then you have, okay, cerebral cortex, cerebral medulla, that's all fine. And diencephalon. Diencephalon is beneath the cerebral hemispheres and has 2 main structures, that is thalamus and hypothalamus. So diencephalon includes, or thalamus and hypothalamus. This diencephalon, it's walnut sized. I mean, we have this, if you observe walnuts, if you remember, so thalamus is equal to size of this walnut. So diencephalon contains thalamus and hypothalamus, and the walnut-sized thalamus is a large mass of grey matter on the either side of third ventricle. You have these ventricles, if you remember the diagram. Yeah, the thalamus is a great relay station for efferent sensory pathway to a cerebral cortex. And hypothalamus, which is a component of diencephalon, exerts an influence on wide range of body functions. It's given in general. Whereas cerebellum is attached to brain and features a highly folded surface. It's important in control of movement and balance. So by now you should be knowing the answer, right? So diencephalon, which lies beneath cerebral hemispheres, has two main structures, thalamus and hypothalamus. So if you remember temperature control, while discussing temperature control physiology, they say thalamus. The relay station is at thalamus, right? Hypothalamus. So hypothalamus controls body temperature, hunger, that emotional feeling, right? A concern and all these emotional feelings, right? So that's concerned with hypothalamus. Yeah, option B, hypothalamus is a part of diencephalon. Option B is the right answer. Okay, so we'll move on to the 9th penultimate question. We still have 10th question. Yes, Lokanath, hunger, thirst, satiety, appetite, anger, fear, pain, pleasure. Yeah. The glossopharyngeal nerve, 9th cranial nerve, innervates all of the following except stylopharyngeus muscle, parotid gland, taste to anterior 2/3 of tongue, and taste to posterior 1/3 of tongue. So we already discussed this in one of the videos. It's even present in YouTube. The nerve supply of tongue. So taste to anterior 2/3 of tongue is supplied by. So taste to anterior 2/3 of tongue, taste to posterior 1/3 of tongue. So taste sensations from the anterior 2/3 are carried by Which nerve in that case, if it is not glossopharyngeal? So glossopharyngeal nerve innervates stylopharyngeus muscle, and also we have a lot of branches. Yeah, chorda tympani of facial nerve. Right, they're carried through the lingual nerve, right? So chorda tympani of facial nerve carries general taste sensations from the anterior two-thirds of tongue. It has general sensations from the lingual nerve. Yeah, except the circumvallate, right? So glossopharyngeal nerve has lingual branches which provides or which carries taste sensations from the posterior one-third of tongue, and also it supplies the general sensations, and it also gives off pharyngeal branches distributed over the mucous membrane of pharynx responsible for this gag reflex. If you remember, we even have one study on managing patients with gag reflex by glossopharyngeal block technique. So if you can block this glossopharyngeal nerve, a patient suffering from severe gag, they can be treated effectively while you are managing such patients in your dental clinic. So it supplies, it has sensory supply to the mucous membrane of pharynx, which is responsible, often leads to gag reflex overstimulation. And also it has a carotid sinus nerve which supplies carotid sinus, that is a baroreceptor, and carotid body which is a chemoreceptor, right? Yeah, so we have these branches of glossopharyngeal supplying stylopharyngeus as well as carotid nerve. Okay, also we have these pharyngeal branches and lingual branches supplying the posterior one-third of tongue, the taste sensation as well as the general sensations from the posterior one-third of tongue. So option C is the appropriate answer, right? Yeah. So we'll move on to the 10th one, the final one for the day. All laryngeal muscles are innervated by a recurrent laryngeal nerve except posterior tracheotomy, thyroid, cricothyroid, and transverse arytenoid. So Anu, you are lightning fast. Anu, Ramesh, Bernice, Aishwarya. So all muscles of larynx except one muscle are supplied by a recurrent laryngeal nerve. That is nothing but, as you say, option C, cricothyroid. Cricothyroid, in that case, it is supplied by external laryngeal, which is a branch of superior laryngeal. Yeah, it is supplied by superior laryngeal. In specific, we have superior laryngeal two branches, internal and external laryngeal. So external laryngeal supplies cricothyroid muscle. So all muscles of larynx except cricothyroid are supplied by recurrent laryngeal nerve. Right, so option C is the appropriate answer, right? Cricothyroid. posterior cricoarytenoid, steroarytenoid, transverse arytenoid. Right. So we'll stop it here. We'll cover 10 questions so far, right? So again, we'll see you in the next live session, maybe today or tomorrow, right? If in case I'm planning any live session today, I'll let you know through WhatsApp update group, right? Yeah. So it's been, I don't know why, but I'm feeling very, very lazy today. Right. So if you have any questions, you can drop them, or you can even drop a mail at proudtobedentist@gmail.com, right? So it's weekend time, so make sure that you complete off your weekly test, right? So I've been telling you constantly, right? So try to stay motivated. So have this positive outlook. So it comes only with practice. Only when you put the right effort and when we are sincere in what we are doing. Obviously, we're going to have that positive feeling, right? So at least from now, it's never too late. You have to be sincere. Start practicing this sincere effort, right? It's not that since we have exam 2 months or just 60 days. I've counted actually yesterday. We have, if at all, we have exam in December and December first week or November ending. We'll be having a solid 50 days. So till November first week from today, we'll be having a minimum of 50 days, right? So you can create a 50-day plan. I've been getting mails regarding schedules. I am also creating one schedule for these next 50 days. But those who are already following the pre-fixed schedule, like comprehensive batch or regular batch, or we have this mission 5 batch, you try to stick on to the schedule, right? If in case you have any issues or you're trying to have this kind of new schedule, I'll just release that as soon as possible. I'm working on it, so I'll be completing that by today or tomorrow, right? So by weekend, by today, tomorrow, or day after tomorrow, I'll be releasing that schedule as well. Okay, so be positive, and that comes not just by thinking philosophically, but by putting the sincere, real effort, right? So it doesn't matter how your preparation was so far. It doesn't really matter now. Whether you're sincere or whether you're getting distracted, doesn't matter now. All that matters now is how you're going to use the present moment and the next coming 50 days, right? So just leave out, don't get demotivated. Like if you feel like I haven't done well so far, so how can I expect myself? No, that again will not push you forwards, right? So leave out everything which has happened already. Even though if you haven't put the real effort, doesn't matter. At least you have time now. At least one should have the satisfaction that we're trying hard, right? So that's very important. That's very, very important. Ultimately, self-satisfaction is the key for happiness, right? You'll get that only when you put the right effort. Be sincere in what you're doing, and try following these schedules for any personal guidance, or if you have any issues whatsoever with your preparation subject, whatever issue it is, right? You can drop a mail around the clock at proudtobedentist@gmail.com, right? I'll provide you full support. You'll have full support from my side, right? Yeah. So have a great day, and I wish you all the very best. Yes, Lokanath, embryology, sure. I'll make time for it also, definitely. So also mail like you do. Okay, you want me to update the live sessions? I didn't get you, Prithvi. What were you asking? Also mail like you do always about live session update. What do you want me to mail? Okay, you want me to mail the schedule? Okay, once it is done, I'll definitely mail. That's for sure. Okay. Yes, Wellness Super 50. Tracheotomy and laryngotomy. I'll have to refer Anu. I don't exactly remember now. So you're asking the difference between laryngotomy and tracheotomy. Yeah. I'll just refer and I'll let you know, right? Maybe after, see, I'll update that in the description of this video, right? Because next live session I'm not sure, so I'll update the difference in this video's description itself. Tracheostomy burn is usually done between second and fourth tracheal ring. Okay. Welcome, Saida. Regina, you say all the best to me. Why? I didn't get you. Unplanned. Today it was like, see, I tried but I couldn't get live. So this was not unplanned, right? So we had this live session in our schedule, 5 o'clock. If at all we're having any additional session, or if at all it gets cancelled, in that case I'll be updating you. And also I thought like WhatsApp update would be more convenient for you, like to look at the message rather than mail. Anyways, I'm updating through both mails. Okay, yeah, Regina, I got you. Thank you. Yesterday's night session, I have sent a mail to everyone, as far as I remember. Sometimes I don't know like what exactly happens. As far as I remember, I think I've sent a mail. Yeah, at 7:57 p.m. I sent a mail. But I don't know whether it's reached, because bulk mail sometimes, there is some delay in sending these mails. I don't know why, but it shows to me like the mail has been sent, but sometimes the recipient might get the mail few hours later. So maybe that was the issue. Yeah, I sent a mail at 7:57 p.m. Prithvi, but I don't know whether you got it or not. So okay, Regina, Bernice and Lokanath. So you got the mail? Okay, maybe. And also I've updated in WhatsApp update group, right? So we have these issues, that's why I'm using one or two, more than one video to give information, right? Yeah. Anyways, we'll again, okay, fine. Then Prithvi, just try checking your inbox once again. Also, if at all you don't have a message, check your spam and make sure that you mark it not spam. I mean, you have this option not spam, then you can divert the mail back into your inbox. Yeah, right. So I've sent it 7:57 p.m. Indian Standard Time. Okay. So have a great day and see you again as soon as possible, right? Also, we have one general session tomorrow. Let's make it more fun and interesting. Yeah. Bye. Love you all.